Knock, knock.
Come in.
Hi, how are you today?
Good, how are you?
Good. I'm going to be your student nurse today. My name is Raylan Sells. Can you give me your name and date of birth for me?
Caitlin Eastling, 9/12/1995.
All right, thank you. And I'm going to wash my hands and close the curtain for privacy and make sure there's adequate lighting in the room. So today we're going to do a physical assessment, and it'll take about 25 to 30 minutes. Are you okay with that?
Yep.
All right. So first what I'm going to do you mind if I sit down?
No,
Go ahead. At this moment? Okay. So first what I'm going to talk about is the general survey. So her appearance, she has good posture, young, female, she's seen white Caucasian, body posture is appropriate, she seems to be in no distress. Her speech seems clear, and her English, she has been, she's able to respond to what I'm asking her, so she does understand the English language. Her dress is appropriate for the weather, and she seems to be, hygiene is good, there's no body odor or anything that looks abnormal. So Caitlin, I am going to say a set of numbers, and I want you to repeat them back to me.
Okay.
4, 6, 8, 10.
4, 6, 8, 10.
Good. And she already told me her birthday, so that would be long-term memory. Now, can you tell me who the president is?
Donald Trump.
Good. And then what would you do if your house was on fire?
Call 911 and get out, evacuate.
Good. And so her knowledge and judgment and short-term and long-term memory are all normal and appropriate. And now, can you tell me, she already told me who she was. Can you tell me where we're at?
The hospital.
All right, and what time of day is it?
Around noon.
Okay, and can you tell me why you're here?
For an assessment.
All right. So patient is alert and oriented ×4. And so now I will put my gloves on, and I'm going to move on to your physical assessment. So first I'm going to inspect your head and scalp. So I'm looking at hair distribution. I'm inspecting for any parasites, moles, and looking for the A, B, C, D, E of the moles throughout this whole skin assessment, and looking for any lesions, and then I'm looking at the scalp for any moles, lesions, or anything abnormal. And the parasites on the back side underneath. And now I'm going to palpate for any tenderness, lumps, bumps, or anything. Does this hurt when I touch?
No.
No? Okay, good. So I'm assessing and palpating for that. So now I'm going to do the temporal pulses. So I'm going to go right around right here. Good. So both temporal pulses are both equal bilaterally, and they are both at the same rate and both strong and equal. So now what I'm going to check is the skin trigger on the top of your forehead, or you can do it on the chest to see if there's any dehydration. And next I'm going to, excuse me, can you smile for me? Frown and puff your cheeks out. Good. So cranial nerve number 7 is intact. And can you open your mouth and close? Good. So cranial nerve number 5 is intact. And moving on to, so I would now take my gloves off, and moving on to the eyes. So I'm going to use my pen light for this. And it's up to you if you want to take your glasses off or not. So first what I'm going to do is I'm going to inspect the eyes. So I'm looking at eyebrows, eyelids, the eyes, cornea, iris, and sclera for any color or drainage. So I'm inspecting the cornea on both sides, making sure they're round. Pupils, the size, so about 3 millimeters on both, and they're both round and equal. The drooping of the eyelid would be ptosis. So I'm looking at equal for, and then the sclera seems to be white, and if you can pull your eyes down like that for me, good. So conjunctiva is pink. There seems to be no swelling or drainage, good, and you can stop that. And now I'm moving on to perla, which is pupils that are equal, round, and reactive to light and accommodation. So I just measured her pupils, and they were 3 millimeters, and they were both round and equal. And now I'm going to do reactive to light, so I'm going to do direct. So I'm going to look into her left eye as I shine the light. Good, and then the other. Good, and then I'm going to do consensual, so I'm shining the light in the left eye and looking in the right. Good. Good. So both both eyes are both reactive to light, and then accommodation. So I want you to look at the top of my pen light, and I'm going to draw all the way in, just with your eyes. Good. So pupils are equal, round, reactive to light, and accommodation. And that's cranial nerve number 3. And so now I'm going to do the extraocular eye movements. So if you want to look at the tip of my pen and just follow with your eyes. And this is cranial nerve 3, 4, and 6. And I'm looking for any nystagmus. The eyes, good. So cranial nerves 3, 4, and 6 are all intact. And then lastly, I would do the Snellen chart. So I'm going to describe that. I would have patient walk up 20 feet away from the Snellen chart and have her cover one eye and read the lowest line that she could, and then do the same with the other eye. If her vision was 20/30, what she can see at 20 feet, an average person can see at 30 feet. So now moving on to the ears. So I'm making sure, first I'm inspecting size, shape, symmetry, making sure they're placed and they're equal bilaterally. Size seems to be appropriate, and they are symmetrical. And then I'm going to look at the auricles and the external ear canal, and with my pen light for any drainage or redness or swelling. Seems to be good. And then I'm going to palpate the ears for any tenderness. Does this hurt when I touch
No.
ears? No? Okay, good. And for warmth, feeling for warmth. Good. And then I'm going to do the whisper test, which is cranial nerve number 8. So I'm going to stand behind her, and I'm going to do a list of numbers. So 1, 2, 3.
1, 2, 3.
And then the other side.
4, 5, 6.
Good. So that's the whisper test, which is cranial nerve number 8. And next I'm going to move on to the nose and sinuses. So first I'm going to inspect the nose, make sure size, shape, and symmetry are all in line in the nose alignment. So I'm looking at the nose, and then I'm going to look in the nose for any excess drainage or any redness or anything abnormal. So, and then I'm going to look at the, so now what I want you to do for, we're going to do nasal patency. So can you cover one nostril for me? Good. And then breathe in. Good. And then the other one. Good. So the nose is painted, and now I'm going to palpate the nose, and excuse me. I'm gonna check for the alignment as I'm palpating the nose, for any tenderness. Does this hurt at all?
No.
No. Okay. So nose seems to be in proper alignment, and then I'm going to palpate the sinuses. So I'm gonna do the frontal. Does this hurt?
No.
Okay. And then the maxillary. Does this hurt at all?
Nope.
No. Good. Good. So those are for the nose and sinuses. And now moving to the mouth and lips. Lips seem to be
Chapped. Sorry.
For the mouth and lips, I'm going to inspect first. So I'm looking at the lips for any cracks or any moisture. They seem to be pink and moist. And then if you want to open your mouth for me, and I will use my and gloves if need be. So I'm going to inspect in the mouth. So I'm looking at any redness or swelling on the gums. I'm looking at the teeth for cracks, and the underneath the tongue for the floor of the mouth, the hard palate on the top, the posterior pharynx, and the tongue for moisture. Sorry.
It's okay.
Sorry.
Okay.
For any moisture, and I can close your mouth for me. So, can you say, I'm gonna have you open your mouth one more time for me. And you say, ah.
Ah.
Good. So, cranial nerve number 10 is intact. And then can you do this for me? Can you move your tongue around for me? Good. So that's cranial nerve number 12. And then cranial nerve number 9 is a gag reflex. So I would put this in the posterior 1/3 of the tongue to stimulate that gag reflex. And that is cranial nerve number 9. And then I would throw this away and my gloves. And then moving on to the neck. So first I will inspect the neck, looking again for size, shape, symmetry, making sure appropriate size for body and appropriate shape, making sure there's no abnormal posture. So I'm going to palpate the neck for any tenderness. Does this hurt at all?
No.
No? Good. I'm making sure that trachea is midline and that it is in place for palpating that as well. Can you shrug like this with your shoulders for me? Shrug your shoulders. Good. So that's cranial nerve number 11, which is intact. Can you do this for me? Flexion, extension, hyperextension. Good. Rotation, lateral flexion, both sides. Good. So range of motion is appropriate and well. And now can we do, I'm going to check your carotid pulse, one on each side. Good. And on the other side. Good. So both pulses are equal bilaterally, and both are strong and equal. And lastly, for the lymph nodes, this would be the submental, submandibular, tonsillar, preauricular, postauricular, occipital, anterior deep superficial cervical, posterior cervical, and supraclavicular are the lymph nodes. And now, moving on from that, we're going to move on to the upper extremities. So first, I'm going to inspect The upper extremities for size, shape, and symmetry. Both seem to be equal in length and symmetrical. And now I'm going to palpate for any tenderness or in temperature and warmth. Does this hurt at all?
No.
No, okay. And then I'm also palpating for muscle strength in the joints. So does this hurt at all?
No.
No? And here?
No.
Fingers? No? All right. So there seems to be no tenderness, symmetrical, and patient seems to be having no pain. And now can you do this for me? So I'm going to have you raise your arm up. So flexion, and then extension, and then as much as you can, hyperextension. Good. And then abduct, and then adduct. Good. And then can you flex and extend? Good. And then inward rotation, outward rotation. Good. And then flexion with your wrist, extension, and then hyperextension. Good. And then radial deviation on the thumb side. Good. And then ulnar deviation. Good. On the pinky side. So range of motion is appropriate. And patient, did it hurt at all in any of those movements? Good. And then can you grip my fingers for me? Good. So patient strength is equal bilaterally. And I'm going to check for capillary refill time at the end. And it should be less than 3 seconds, which it is. And then I'm going to check the pulses. So if you want to put your arms up for me, good. So I'm going to check the brachial pulses. And then the radial.
Sorry.
Oh, sorry. No, you're good. Radial. I'm sorry, ulnar. And then the radial. Good. So all pulses seem to be equal and bilaterally. And next is the lungs. So first I'm going to inspect patient's breathing pattern for effort, rate, strength, and symmetry. So patient doesn't seem to be in any distress. She's not using any extra accessory muscles. Seems to be at a normal rate. And so next I'm going to look at the skin. And I'm going to be inspecting anteriorly and posteriorly throughout this assessment for the lungs. So both on the back side and the front side, the breathing rate is normal. The skin on both the front and the back, looking for any moles, lesions, bruises, bumps, or lumps, which there seems to not be any at the moment. Looking at the skin, and then I'm going to palpate for any tenderness. Does this hurt at all?
No.
And temperature, does this hurt at all?
No.
Good. And then temperature, which is warm, there's no moisture. And then I'm going to do the AP diameter to transverse diameter. So AP diameter, good. Good. So it should be 1 to 2 for AP diameter to transverse diameter. And then I'm going to do tactile fremitus. So each time I touch your back, I want you to say 99, okay?
Okay. 99, 99, 99, 99.
Good. So as the vibrations decreased as she was saying 99 down the back. And now I'm going to check for chest excursion at T10 to see the symmetrical and her breathing patterns. So can you, so I'm at T10, and then can you take a deep breath in for me? Good. Good. So my hands move symmetrical bilaterally. And now we're moving on to the, for the AP diameter, it's the AP diameter to transverse diameter, it is 2 to 1. So this is 2 to 1. And then for, I'm going to now listen to the lungs. So there's 10 points on the back, which is where I'm going to start, and then 8 points on the lateral, and then for posterior, or for anterior, there's 8 points as well. So I'm going to listen bilaterally on the back, and underneath clothing, not on top. If you, each time I touch your back, if you want to take a breath in, a deep breath in, and a breath out.
Okay.
Okay? Good. 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 Sorry.
No, you're
Sorry.
It's okay.
Good. 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 So lung sounds are sound clear bilaterally, and now for the lateral side. You okay?
Yep.
Okay. Good. And then, oh, sorry.
No, you're fine.
I don't know what's easiest.
It doesn't matter.
Okay. Whatever you prefer. Good. All right, one more. Good. So lung sounds are clear bilaterally on the lateral side, and now for anterior.
I don't know. It doesn't matter.
No, you're good. Good. Over here. Good. And then over here. Good.
Okay.
So lung sounds are equal and clear bilaterally, on anteriorly, posteriorly, and laterally. And next, I'm going to listen to our heart. So if you can lie down for me. So for the heart, first I'm going to identify the listening posts. So for the heart, the aortic is on the second intercostal space on the right sternal border, and then the pulmonic is on the left sternal border on the second intercostal space, and then Erb's point is on the third intercostal space on the left sternal border, and that's where you'll hear S1 and S2 at the same time, and it'll be equal. And then the tricuspid valve, the tricuspid, which is on the fourth intercostal space on the left sternal border, and then the mitral, which is on the fifth intercostal space on the left sternal border on the midclavicular line. and that's also where you will hear the apical pulse, or where I will also do for 1 minute on the apical pulse. S1, you will hear the closing of the valves of the mitral and tricuspid, and then S2, you will hear at the closing of the aortic and the pulmonic valves. So first I'm going to look for the precordium and the point of maximal impulse. So I'm looking at the PMI at eye level. I see it about right here. Good. And now I am going to listen to her heart, and then I will listen to her, or I will do the apical pulse for 1 minute. So I will listen to her heart with the diaphragm of the stethoscope and then the bell. Good. Good. And I'm going to listen to her apical pulse for 1 minute. And I got 73 for the apical pulse, which is normal. And now I'm going to move on to the abdomen. So I'm going to be listening in the 4 quadrants of the abdomen, but first I'm going to inspect the abdomen. So I'm looking for any bruises, I'm looking for any distension or the concave of the stomach, which there seems to be none. I'm looking for any lesions, moles, any bad skin integrity, but everything looks great. And then I'm going to listen to the 4 quadrants, and I want to hear 5 to 35 bowel sounds in each quadrant. I'm sorry, I'm going to have to go back up to the heart. I need to listen to the bell for the heart really quick. Sorry.
That's fine.
I said I was going to do it, and then I just went on with the other ones. So I'm just going to listen to the bell with the bell real quick. Good. 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 All right. Now we can move on to the vowel sounds. Sorry about that. So for the vowel sounds also, when was your last bowel movement?
Yesterday.
Okay. And do you have to go to the bathroom or anything before? No? Okay.
Nope.
So I'm going to listen in the 4 quadrants, and I want to hear 5 to 35 vowel sounds in each quadrant. So you're 7 in that one. I heard 6 in that one. I heard 6 in that one. And I heard 6 in that one. And then next and lastly, I'm gonna palpate the stomach. So I'm just checking for firmness and any tenderness. So does this hurt when I touch your stomach?
No.
No. So there's no tenderness. There doesn't seem to be any distension or any abnormalities. And she said she has no pain when I'm touching her stomach, which is good. And then, so you can put your shirt back down for me. Perfect. And then, moving on to, I'm actually going to check, just the bladder. So I'm checking for the firmness. Does this hurt at all? Good. All right. So now I'm moving down to the lower extremities. So, for the lower extremities first, I'm going to inspect size, shape, and symmetry. And they both look symmetrical and equal bilaterally. And then I'm going to palpate and look, but I'm also looking first for any moles or any lesions. And then I'm palpating for any tenderness, warmth. Does this hurt at all?
No.
Good. And then I'm going to check the calves for any edema and looking for any DVT when palpating. And then I'm going to check the pulses for the lower extremities. So that would be the femoral, which is like right here. And then the popliteal, which is underneath the knee. Good, thank you. Which is right there. Good. And then the posterior tibialis. And then the dorsalis pedis. So, pulses seem to be equal by strength and equal and strong. And I'm going to check your range of motion. So I did the pulses. I'm going to check your range of motion. But first, I'm going to double check the joints. So does this hurt at all?
No.
Anywhere? Joints. I'm checking also her muscle strength. And the muscles for any tenderness or swelling, which there seems to be none. And then, can you pull your feet towards you? Yep. And then press down. Good. So strength is equal bilaterally. And then I'm going to check the toes on the top of the toes and around the toes for any for capillary refill, which is good. Good. So I inspected, I palpated, I did the pulses, looking at the toenails, there's nail polish on them, but I would look at the nails for the distribution and the nail beds to make sure they were clean and cut, which they do seem clean and cut, but I can't see underneath. And then if you want to close your eyes for me, and I'm going to do assess pain. So what I'm going to do is I'm going to break this tongue blade, maybe. So it'll be one side sharp and one side's dull. So one side's going to be sharp and one side's going to be dull. And I want you to say either sharp or dull.
Okay.
Okay? So I want you to close your eyes for me.
Sharp. 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 Dull. Can you do that one again? Dull. Sharp. Sharp.
Good. And then I would throw this away. And lastly, is the range of motion. So, for range of motion, you can sit up for me now.
Okay.
And, actually, you can stand up if you want.
Okay. That's fine.
So what I want you to do, is if you can flex your knee and then extend, and then, can you abduct and then adduct? Good. And then I want you to do plantar flexion, which is down, and then dorsiflexion with angle. Good. And then inverted.
Terrible balance.
Good. Rotation and then outward. Yep. Good. And so range of motion is appropriate. And then lastly, we're going to check her gait. So if you want to walk that way a couple steps, straight, good, and then turn right back around and walk this way, good. So gait is steady. And then we're going to check for the Romberg test. So can you put your feet together for me? Yep. And then if you can close your eyes for me. So for the Romberg test, you're checking for any swaying, which would be a positive Romberg test, which she is not. So Romberg test would be negative. You can open your eyes. And then we're going to do RAM, which is rapid alternating movements. So if you have your hands on your legs, and then I want you to go back and forth, and then go as fast as you can. Good. So that would be rapid alternating movements. And then lastly, I'm going to check your spine.
Okay.
So if you want to bend down like you're touching your toes. Good. So I'm looking at spine alignment. I'm making sure one shoulder isn't slouching to the side, which could mean scoliosis. You can stand back up for me. And so I'm looking for scoliosis, lordosis, or kyphosis. And then lastly, I'm going to check your range of motion of the spine. So can you go to the side for me? Good. The other side. And then forward, backward. Good. So that is the completion of the assessment. And so I'm going to, you can sit back down. And do you need anything before I leave?
No.
All right. It was a pleasure meeting you, and thank you for letting me do your assessment today.
Thank you.
So then I would document my findings, and then I am all set.